When it comes to intimate health and personal care, questions about what we put in or near our bodies are important and often overlooked. Many people wonder about the effects of using oils with their vagina, whether for lubrication, massage, or other purposes. Understanding how different oils interact with the sensitive vaginal environment is crucial for maintaining comfort, health, and well-being. First, let's talk about the basics of vaginal health. The vagina is a self-cleaning organ with a delicate balance of the bacteria and an acidic pH, typically ranging between 3.8 and 4.5. This balance is crucial for preventing infections and maintaining a healthy environment. Introducing substances that alter this environment can have various effects, both positive and negative. Oils are often used as natural lubricants. They can provide a smooth, slippery texture that reduces friction during sexual activity, or when using menstrual products like tampons or menstrual cups. Popular oils include coconut oil, olive oil, vitamin E oil, and mineral oil. Each of these oils has unique properties, but what they all share is that they're not specifically designed for use with the vagina. Let's explore what can happen when oils are used in the sensitive area. One of the primary concerns is the potential for irritation or allergic reactions. The skin around the vulva and inside the vagina is more sensitive than other parts of the body. Some oils, especially those that are heavily processed or contain additives, fragrances, or preservatives, can cause redness, itching, or burning. Even natural oils can trigger reactions in people who are sensitive or allergic to them. For example, coconut oil is generally well tolerated, but some individuals might develop a rash or discomfort after use. Another important consideration is how oils can affect the balance of bacteria in the vagina. The healthy bacteria, mainly lactobacilli, help keep the vaginal environment acidic and prevent the growth of harmful bacteria and yeast. Oils do not contain water, and when they are introduced into the vagina, they can disrupt the natural flora. This disruption can increase the risk of developing bacterial vaginosis or yeast infections. Signs of an imbalance include unusual discharge, odor, itching, or irritation. Some oils have mild antimicrobial properties, such as coconut oil, which contains lauric acid. While this can be beneficial in some cases, it's not a replacement for medical treatment, and the effects are not well studied in the context of vaginal health. The use of oils with strong antimicrobial or antifungal claims should be approached with caution, as they can also kill beneficial bacteria and upset the vaginal ecosystem. When it comes to sexual activity, using oils as lubricants can have added risks, especially if condoms are involved. Most oils, including natural options like coconut and olive oil, as well as commercial baby oil and petroleum jelly, can weaken latex and polyisoprene condoms, causing them to break or tear more easily. This increases the risk of unintended pregnancy and sexually transmitted infections. If you rely on condoms for protection, it's best to use water-based or silicone-based lubricants that are specifically tested for compatibility with condoms. Another aspect to consider is the impact of oils on sex toys or menstrual products. Oils can degrade certain materials, such as latex and some forms of silicone, causing them to break down or become sticky over time. This not only shortens the lifespan of these products, but can also create tiny cracks or pores that make them harder to clean, increasing the risk of bacterial growth and infection. Some people use oils for vaginal massage or moisturizing, especially if they experience dryness or discomfort during menopause or at other times. While oils can provide temporary relief, they don't address the underlying cause of dryness, which might be hormonal changes, medications, or other health conditions. If vaginal dryness is a persistent issue, it's important to speak with a healthcare provider, as there are products specifically designed to restore moisture and maintain pH balance without increasing the risk of infection. For those interested in natural or DIY approaches to intimate care, it's important to choose oils that are pure, unrefined, and free of additives. Always test a small amount on the skin outside the vagina. First, to check for reactions. Avoid using essential oils directly in or around the vagina, as they are highly concentrated and can cause significant irritation or burns. If you use essential oils for aromatherapy or relaxation, keep them away from the genital area unless properly diluted and tested. It's also worth noting that some oils, particularly those that are thick or petroleum-based, can linger in the vaginal canal. This can trap bacteria or other debris, contributing to infections or odors. The vagina is self-cleaning, and introducing substances that don't rinse away easily can interfere with this natural process. For individuals who are prone to urinary tract infections, using oils in the genital area can sometimes increase the risk. Oils can provide a medium for bacteria to travel from the anus or perineum to the urethra, especially during sexual activity. Good hygiene practices, such as wiping from front to back and urinating after sex, can help reduce this risk, but it's something to keep in mind. In summary, using oils with your vagina can have a range of effects, from providing temporary lubrication or comfort to increasing the risk of irritation, infection, or condom failure. While some people find that oils work well for them, others may experience negative reactions. The most important thing is to listen to your body, choose products carefully, and consult a healthcare professional if you have concerns or experience symptoms like itching, burning, unusual discharge, or persistent discomfort. Ultimately, maintaining vaginal health is about balance, supporting the body's natural defenses while being mindful of what you introduce to such a sensitive area. Commercial lubricants and moisturizers labeled as safe for vaginal use are formulated to work with the body's natural chemistry. If you prefer natural options, opt for pure, simple oils in moderation, and always pay attention to how your body responds. Your comfort and health are worth prioritizing every time.